Hello everyone, it's Dr. Zach Borus from Dickinson County Board of Health and Lakes Regional Healthcare here in Spirit Lake, Iowa. It is the afternoon of June 16th, though this will go live on YouTube on the 17th. I'm going to take my mask off, we're distancing, but this is what we're doing. Actually, as I take this off, you'll probably see the mask lines on my face from my N95 mask that we're wearing all the time here at the hospital as well. Trying to do our best to preserve our workforce and take care of ourselves and limit pre-symptomatic or asymptomatic spread here at the hospital. So just want to give you hopefully briefer update today. Obviously it's been a busy week here in Dickinson County. I think there's a lot of news going on. There's a lot of information, most of which is quite real, some of which is some misinformation, so I just wanted to give you a heads up as to where we are, what is happening in terms of testing here, where we likely will see this go, and resources that are available for you as members of the community as well as for the business community. So as of this morning, there were 157 confirmed cases in Dickinson County. As I've said before, that is people who have gotten tested really anywhere in Iowa or nearby who has put down a Dickinson County residential address. That is likely, we are hoping that that's counting summer residents as well and people who are staying here for some significant amount of time. But again, there are folks who work here or who are spending significant time here who have tested positive who are attributed to other counties because that's where they live or that's where they spend most of their time. So 157. When I talked to you last Monday, it was a 55. I would guess that by the time this comes out on YouTube, there will be another 10, 20, who knows. But as of this morning, there were 50 tests pending through our testing site here, plus others through Test Iowa, I'm sure. So there's more than that who will be positive. Unfortunately, the county did see its first death from COVID yesterday, actually 2 nights ago, and it was an elderly gentleman who was hospitalized in Sioux Falls. So again, as our press release stated, we extend our condolences to the family and wish them comfort in this difficult time. Really, obviously, any loss is quite a loss. So my hope is that that's the last that we see. I would guess that we will, unfortunately, as the numbers go up, we will see more folks who are hospitalized, who are sick. In terms of numbers around the state, they continue to rise, though it's overall sort of steady. We've plateaued, as have many states. I think that a lot of that is because there were rapid early spreads in highly populated areas like Des Moines, and those have settled down. But we're seeing obviously a lot of rise in counties like Dickinson, like Clay, etc. So some of these smaller communities like ours are really just getting it for the first time. Across the country, we're at 115,000+ deaths. This is not going away. Whether this is a second wave or continuation of the first wave, I think it's actually more like first wave and then it plateaued, and we're just seeing continual amounts of infection, death, and then I think that as more and more states continue to open up, it is going to rise again most likely. So we just need to continue to be cautious and take care of each other, take precautions, especially if you have high risks. So testing. We continue to be able to test everyone who qualifies for testing at the hospital. So again, you'll call 336-6696, and that is if you have any symptoms of COVID-19. So cough, shortness of breath, fever, or some of the newer symptoms which include nausea, vomiting, diarrhea, loss of sense of taste or smell, headaches, sore throat, muscle aches. There's 1 or 2 others, but if you've got any of those, call the number and get triaged, okay? So if you have any of those, you technically qualify. Additionally, if you have any known exposure to someone who has tested positive, you also qualify. So that exposure means within 6 feet of that person for more than 15 minutes. Not a secondary exposure like my husband works with someone who is positive. But if your husband has tested positive, then you qualify for testing and should be tested, because we want to catch every case that we can so that we can accurately know how spread this is locally, and so that we can try to identify folks who really should be staying home. That said, if you have symptoms, you should be staying home. You shouldn't be working, ideally. If you are waiting for a test result, unless you have other HR guidance from your workplace and have personal protective equipment that you can wear, you should be staying home. Okay, so that's how you get tested through the hospital. Excitingly, starting likely early next week, and details will follow, we are starting a Test Iowa site here in Dickinson County. This is going to be a partnership between Dickinson County Public Health, the hospital, and the county and state. And we as hospital and clinic HR will be staffing that site. It's likely going to be up at the Expo building, and you will go to testiowa.com or .org.com, I believe, fill out the questionnaire, and then anyone who wants to be tested can be. So that is a way for those of you who have had those potential, secondary exposures, or who have had an illness, well, not who have an illness, but because we still want to see you if you actually are sick. But for people who have no symptoms, who have known or presumed exposure, that will be a way for you to get tested quickly, free out of pocket, and with increased access. So that'll be a drive-through site. We're still working on the details. You will see more of that later this week, but we're all very excited to be able to offer that. But again, our expectation is that if you are having symptoms, that you still call the respiratory clinic, because we still want to get you taken care of and get you really evaluated. Sometimes the illness can be more significant than it feels initially, so we want to get you checked out. So exciting news. Also, as Dr. Cunningham mentioned in his videos last week, serology testing, so antibody testing is available here. Our process has changed a little bit, but you'll call Lakes Family Practice at 336-3750 and say that you want antibody testing. You can touch base with your provider as well, and then you can set up a lab time to do it. At this point, it is being offered cash or check only for $80 up front. Some HSAs and FSAs are reimbursing, but our reference lab that we're sending it to, which is Avera, needs that payment up front when you get tested. Then you should be informed of the results within 24 hours, most likely. So we're excited to offer that, again, with the caveat that we don't exactly know what it means. So it's more for academic purposes at this point to know if you have had it. If you have antibodies, it does not mean that you are immune, and certainly doesn't mean that you are immune long term. So you've heard me say that before, but I just wanted to reiterate. So that's where we are. Numbers are rising, as we've said. We still see a lot of folks from out of town and a lot of folks who live here who are still not following really many of the recommended guidelines. Our governor has taken away all legal restrictions on gathering at this point, and on capacity at bars, restaurants, houses of worship, theaters, etc. And so I think we're seeing a little bit of a free-for-all, which certainly concerns many of us. With these numbers going up, we are lucky here at Lakes Regional that we have not had any confirmed inpatients who do have COVID. We remain fully capable of managing those folks. At this point, we have isolation rooms, we have ventilators, we have CPAP and BiPAP machines, and we have a talented team who will be able to take care of people. At the same time, we have had a few people from Dickinson County, including the person who unfortunately passed away, who have gone to Sioux Falls because of their level of illness and because of availability of ICU beds there. So it's here, and I think it's just a matter of time. Thankfully, most of those who have gotten sick thus far are in the 20 to 40 age range, if you look at the Iowa information site, and most of those folks are going to be either minimally or not at all symptomatic. Again, when those people then get their moms or dads or grandparents sick because they're in close contact, that's where things get worrisome to me, and where I think we're going to see a lot more numbers in the hospital, and unfortunately a lot of people more ill. So please continue to be cautious. Please continue to limit your exposure to other people inside. Please continue to keep at least 6 feet of distance between you and your friends if at all possible. Please wear a mask when that is not possible. We are doing WebEx tomorrow through the Chamber of the Iowa Great Lakes. with business owners. So if you are a business owner, look at your email from the chamber, check your spam folder if you haven't seen anything. But at noon tomorrow, we're doing a WebEx for best practices that businesses can follow. A little preview is have your staff wear masks, make them able to wash hands frequently, encourage your patrons to wear masks if at all possible as well. I give a lot of credit to the number of businesses who are already doing so to protect their own staff and to protect their patrons, because really having your staff wear masks shows respect for those who are visiting your establishment. So please continue or consider doing that if you are a business owner. We're just in the thick of this, so I think numbers are going to go up, especially as we start being able to test more people without symptoms in the coming week or weeks. My hope is that people use this as an opportunity to really think about what they're doing and perhaps not tie up with another 30 boats in Miller's Bay this weekend. Get out there, anchor, have fun with your family or your small friend group, but please don't all come together. It's weird, it's a strange time, but it's what we're living in, and we can make this better by continuing to distance and wear masks when able. So I think that's all I have. I don't know how brief I was, but probably not brief enough. Thank you for your time and for your interest. Let us know if you have questions or concerns, and if you're feeling sick, call the respiratory clinic. If you're not and you want to get tested, then look to next week when we have the Test Iowa site. And if you have been in close contact with someone who has tested positive, by all means, please get tested and take care of yourself. So have a wonderful day. We'll be in touch. Thanks.